Thank you, Mr. President. I stand before this Honourable Court today in response to the coronavirus or COVID-19 public health threat we face, and we must all play our part to protect each other, our families and our island's community. Can I start by thanking Honourable Members, Mr. President, for the support and commitment that all Honourable Members have given to stand firm and ensure that we've shown a united position on this in order to support our population. The actions announced yesterday seek to protect the most vulnerable in our society, provide a safe island and also preserve and protect our health service on which we all depend. The Department has been preparing the Isle of Man response for a number of months now in relation to COVID-19 and will continue to be at the heart of our cross-government response for many months to come, not least right at the forefront of care delivery as we move into the critical phases of this unprecedented worldwide situation. As a department, we have until the last few days followed Public Health England advice throughout, because that has been the sensible thing to do. However, with the changing position in our near neighbours, I believe it is now the correct approach for us to vary our advice in the best interests of our wider island community. We will, of course, continue to monitor public health advice and developments elsewhere, but the actions we decide on may well not always be aligned with that advice elsewhere. Working with our clinical and managerial operation leaders, we have enacted a suite of decisions and future options in order to best prepare the Isle of Man for what will be the inevitable COVID-19 cases that will occur. By way of background, Honourable Members will all be aware, Mr. President, that coronavirus of this type is a type of virus common across the world. Most are like a common cold, some types are more severe, for example SARS and MERS. This new virus causing COVID-19 emerged in Wuhan, China in December 2019. Now more than 142,000 people have been infected and 5,300 deaths across 100 countries has resulted. Symptoms include fever and a cough that may progress to a severe pneumonia causing shortness of breath and breathing difficulties. The current evidence from around the world, Mr. President, is that most cases of COVID-19 appear to be mild. Currently, 94% of all active cases worldwide are classified as such. Severe symptoms are more likely in people with weakened immune systems, older people, and those with long-term conditions like diabetes, cancer, and chronic lung disease. In order to combat and respond to this threat, the Department is seeking to do the following. Firstly, the first part of the strategy is to contain, to detect early cases, follow up close contacts, prevent the disease taking hold on Ireland for as long as reasonably possible. The other thing we are looking to do, where there will be inevitable cases, is to delay, to slow the spread of the virus on Ireland, again through contacting individuals and self-isolation. That way it will lower the peak impact and push it away from the winter season when the NHS is already stretched. We also, of course, continue to look at research as well and incorporate new developments into our response as they become available. This may well include new diagnostics, drugs and vaccines, and I will, of course, keep this Honourable Court updated as and when any developments in that area occur. We are also looking to mitigate and provide the best possible care and support for people who do become ill, and support nobles to maintain essential services working across government to minimise overall impact on society, public services and the economy as a whole. Throughout the now pandemic situation, the main approach has and will continue to be to support respiratory hygiene, hand washing and social distancing. This will continue to be important and ultimately aiming to slow transmission to reduce the impact on NHS, the public services, the economy and wider society. In terms of our response going forward, Mr. President, I have several announcements to make to the Honourable Court. Firstly, and the Chief Minister beat it to me due to one of the questions that he got, we are developing a hotline, Mr. President, our equivalent of the NHS 111 line that is going to be available very shortly, and there will be further announcements shortly in relation to that, which will allow us to have a triage situation where people are no longer having to contact their GPs and meds. Services are being prioritised, and many honourable members may have already heard that we are, with effect from today, ending elective surgery to allow time for staff to be retrained to meet any expected demands around COVID-19. This is a sensible precaution to take, Mr. President. I know it will cause great upset and distress to some people who have been waiting for elective surgery for some time, but it is important that we plan that if there is an outbreak on Ireland, we have appropriate staff trained up to be able to cope with that. Changes are being made in the emergency department as well to create relevant isolation areas. So meds will be moving out of their area at the Nobles and into Palatine, and the area that is currently meds will be turning into the isolation area for the emergency department should anyone present there. Although I must emphasise again to the public that should they be showing symptoms, they should not attend their GPs, they should not attend the hospital, they should instead actually either call their GP or meds, or once the hotline is live, that number to seek advice. We are also going to be asking, with effect from the 18th of March, Mr. President, that anyone suffering from minor injuries, instead of attending the emergency department at Nobles, will be asked to attend at Ramsey District Cottage Hospital minor injury unit to stop the flow, the mass flow into ED. Obviously, Ramsey only opens certain hours, and it will be during those hours of opening that we'll be asking people to do this. Estates work is also underway or in the process of planning in order to create additional isolation side bays or decant spaces. And we are also assessing all patients that are in Nobles who are medically fit being prioritised for discharge. In this case, we believe there may be up to 50 patients where we can either discharge or, if necessary, transfer to Ramsey and the step-down facility. We are also looking at the delivery of virtual clinics across all services, and these are being developed as quickly as possible, particularly in relation to outpatients and in primary care. And we are also working with our third-party tertiary hospitals in the UK to see if many of what is now patient transfers can actually be done via these virtual clinics as well. We also have plans being put in place to support the most vulnerable in our society who are living alone or in nursing care homes. We've been speaking to the voluntary sector, and we will also be repurposing staff in non-emergency areas in order to help cover this. Workforce modelling is being undertaken in line with the changes being made around clinical service prioritisation, but also to create the relevant contingency planning around the nursing establishment to make sure that we have the right people in the right roles and able to cope with this should cases emerge. We are also building a network of external support, volunteers and recently retired personnel enabled to support what we are doing. The other announcement I have to make today, Mr. President, is, as honourable members will be aware, we are currently redeveloping the private patients unit to be reopened in June. As Minister, I have taken the decision to put that development on hold. As many honourable members will be aware, the private patients unit has a large number of individual rooms, and I have therefore taken the decision that that is much more important in our COVID-19 planning. That is not to say the entire thing is on hold, Mr. President. We will be continuing to go out to seek a third party to help us deliver our private patients offering in the future, but for now we will not be meeting the June date because we will be needing that facility in the potential for any outbreak. As a department, there is a significant number of risks to manage, and we will continue to be, and that will continue to be the case over forthcoming months, and I will update this Honourable Court as and when required. Despite the rumours that are out there, Mr. President, I can confirm yet again there currently remains no confirmed cases of COVID-19 in the Isle of Man, and despite the UK's decision to halt testing outside hospitals, here in the Isle of Man we will be continuing with testing in the community. I also need to be clear on self-isolation, Mr. President. As the Chief Minister has already stated in his statement, guidance notes will be available for individuals on the process, but the key point I need to get across, Mr. President, is if you need to self-isolate, you stay at home. Walking the dog, going shopping, going for long walks, as I have seen suggested by some people last night as being acceptable, is not acceptable, Mr. President. That is not self-isolating. Anyone required to self-isolate must stay at home for the 14-day period. That is the key message. Can I also echo the Chief Minister's comments around panic buying. There is absolutely no need for panic buying, Mr. President, as all of the supermarkets, both on the island and in the UK, have made absolutely clear the supply routes remain strong, they continue to deliver in the same way as they previously have, and there is no risk in terms of supply into the island. All that panic buying is doing, Mr. President, is exposing the most vulnerable in our society on fixed incomes to not being able to get their key essentials, particularly around ordinary day-to-day medicines like paracetamol and even children's medicine Calpol. So I would urge everyone to actually think about what they're doing in that regard. We are a strong community, Mr. President, and by pulling together and actually considering others, we'll get through this just as we have with previous situations. There is no need for anyone to be stockpiling. Also, Mr. President, in relation to travel, the key advice is that there should be nothing but essential travel onto or off island. That is exactly what we are advising, and again I echo the Chief Minister in that. In relation to COVID-19, Mr. President, the number of secondary infections generated from one infected individual is currently understood to be between 2 and 2.5 other individuals, higher than that for influenza. And that is why the firm action that we have taken was needed. DHSC will manage the patients and do everything it can to reduce transmission, but the public control measures, such as those unveiled yesterday, are the only way to make some difference in managing the impact of the virus. That is why the Chief Minister made the announcements that he did yesterday. And Mr. President, in making these decisions, we have been listening to our scientific, clinical and leadership advice. The actions clearly affect all of our daily lives. Many may seem tough and will have impact for many of our population. But by taking these tough decisions now, we will ultimately save lives. I would like to thank all of those hard-working, dedicated staff across our health services who have had even more pressure than normal on their shoulders over the last few weeks. As always, not only have they stepped up to the mark, Mr. President, but they've crossed over it. I would like to thank them for their continued dedication. I hope that all members of this Honourable Court will continue to support us in ensuring the safety, security and well-being of our island.
Minister. Honourable Member for Onken, Mr Callister.
Thank you, Mr President. I thank the Health Minister for his very strong statement this morning. Can I ask the Minister how many people travel to the UK for hospital treatment on a regular basis, say 14 to 21 day period? And should we therefore be considering obtaining accommodation in the UK in order to keep isolating these patients when they keep coming back to the Isle of Man?
Minister to reply.
Thank you, Mr. President. The key point in relation to that, which is the key point in the statement, is we are assessing all patients that currently travel over. Because, and I think I've mentioned it in this Honourable Court before, there are many patients that actually travel over to the UK to be seen by a consultant, simply to be told, to be asked, how are you? And then basically sent back. Those people, Mr. President, I need to emphasise, will not now be travelling. We will be looking for other solutions, virtual solutions, in order to stop that. So when we say non-essential travel, that will be in relation to patient transfer as well. In terms of those people going over for cancer treatment, it will be looked at, and other sorts of treatments, it will be looked at on a case-by-case basis. Some, for instance, will receive more regular treatment than others. If you've got people who are actually having treatment after treatment after treatment, it may be sensible for a long-term stay in the UK for that treatment. For those that are coming backwards and forwards, they may need to self-isolate coming back if it's less regular treatment. But it will be done on a case-by-case basis with patient transfer, Mr. President. But the key thing that we're looking to do is get more outpatients appointments on island, and also looking to do virtual.
Mr Callister, I'll allow one supplementary question.
Thank you, Mr President. Can I ask the Health Minister, are we now testing everybody that dies on the island? And if we are, when did that process start?
Minister to reply.
Thank you, Mr. President. I'm not aware of a single one of the 155 jurisdictions that have had infections that are doing that, and the answer is no.
Honourable Member for Russian, Mr Speaker.
Thank you. Could I ask the Minister how self-isolation will be enforced and under what powers, and whether people will be asked to register that they are self-isolating so that the Department can track the numbers and track the data, and how that will work?
Minister.
Thank you, Mr. President. In relation to the self-isolation, the Governor has made a relevant proclamation yesterday under the relevant Act. Off that, regulations will flow that will allow for the prosecution of people who do not abide by self-isolation. I will state very clearly to this honourable court, Mr. President, this is a serious matter. This is not something that has been done lightly. And anyone who flouts it and is caught flouting it, there will be appropriate action taken against them. In relation to the second half of Mr. Speaker's question, the Department is looking at ways of people registering to be able to say they're self-isolating. This will involve, obviously, the phone line we're setting up, but also I have asked for web-based solutions to be able to be developed as well, because it should not be within the, it should not be without the wit of us being able to have a drop-down form that someone can submit so that we can keep track of where people are self-isolating around the island. And also, that is also key, Mr. President, without me whittering on any longer, in order to ensure that we can identify any cluster groups as well as to where things might be developing.
Honourable Member for Council, Mrs Lord Brennan.
Thank you, Mr. President. The Minister rightly refers to cross-government responses. Will he commit to ensuring across government timely, accurate, clear and consistent communication on social media, acknowledging that many people are simply not going to watch the interviews? Some people are not going to know or indeed go to a website, and it's concerning that government communication has been patchy. And the last post on Twitter, for example, from Public Health was 3 days ago. Will he commit to improving these communications on social media for the public? Thank you.
Minister to reply.
Thank you, Mr. President. Social media can be a very good tool when used correctly, and most definitely the comms division of government is taking everything in centrally, and it is a government-wide response. The National Strategy Group is meeting daily now in order that we can actually get that response together. The Honourable Member for Council will have also seen, Mr. President, the way we rolled out yesterday in terms of press conference, etc. We are planning to do more on that, but definitely social media and getting the message out there is important. Unfortunately, there will always still be people who won't believe that message or won't listen to that message, but we can but try.
Honourable Member for Middle, Mr Shimmons.
Thank you, Mr. President. I thank the Minister for his statement. What equipment is in place to protect healthcare professionals and also the other personnel in our emergency services?
Thank you, Mr. President. In relation to the question, I assume the Honourable Member for Middle is referring to personal protective equipment, such as the suits, etc. In terms of this is why we have a very clear line in terms of testing, that people should not present to hospitals, they should not present to GP surgeries, they should actually ring and then we will arrange the testing at an appropriate place. In relation to the public PPE directly, the stocks are controlled by the NHS supply chain. We are actually in a better position than the Channel Islands that aren't a member of NHS supply, in the fact we can source the equipment there. The supply, as you would expect, is being controlled, so it's not just going to be issued generally, it will be issued dependent upon the situation. The situation in the island at the moment is we have no confirmed cases, so there is limited supply, but obviously if the situation changes, then that will change as well.
One supplementary question, Mr Shimmons.
Thank you, Mr. President. I'd like to ask the Minister, will the Acting Chief Executive for the Department be located full-time on the island in our time of need?
Minister.
Thank you, Mr. President. Actually, the responsible officer for leading this is actually the Chief Operating Officer, because the Chief Operating Officer is the person that ties together the hospital services and the community services, and the Chief Operating Officer is based on Ireland.
Honourable Member for Ramsey, Mr Hooper.
Thank you very much, Mr. President. I have two questions for the Minister. The first one, he mentioned community testing that's going to be carried on the island. Can you just provide some information on what that means? The reason I ask this is he's indicated it might just be people that have symptoms. I've been contacted by a number of people who care for elderly relatives and are concerned about not being tested themselves before actually going to care. So is there some guidance that's going to be issued? What does community testing really mean? The second question I have is, a hotline has been mentioned about triaging cases. Is there going to be some support in place to help GPs triage within their own practices, within their own surgeries, to make sure that only people that need to be seen are being seen and that people aren't end up sat in waiting rooms where they don't need to be? So two questions. Thank you.
Minister to reply.
Thank you, Mr. President. In relation to community testing is the most vulnerable individuals in our society. So people, for instance, who are feeling exceptionally ill, the bit more elderly, those with mobility problems, they will be tested in their own homes. There is going to be announcements later this week around us actually having community testing points, but they will only be for people who've been advised to go to those points. I need to make that absolutely clear. In terms of testing, it will be those showing symptoms. The guidance on that is very, very clear. The reason being, if you just have people randomly turning up to be tested, then what will happen is the entire system will backlog and fall over, and those who are most in need of testing won't be able to get the tests processed in a quick enough timescale. I would also point out that, as has been shown in several other jurisdictions, just randomly testing or people just presenting doesn't work, because they might not be infected on the Monday, but after contact with people on the Tuesday and Wednesday they might be, and that test might come back clear, and that then gives them a false sense of security that they're not infected. So we need to do it on a symptomatic basis. In relation to GPs and triaging, we will be saying once the helpline is up, anything in relation to this should go through the helpline, so people should not be at that point ringing the GPs or meds. The GPs and meds is the phone number now until that hotline is in place, but once it is, the GP's surgeries for anyone ringing up about COVID-19 will be redirecting them to the hotline.
Honourable Member for Council, Mr Henderson.
Actoren, I have got a couple of questions. First one is to reiterate Mr Shimmons' question, Honourable Member for Middle. Really feel, Minister, can you confirm that in fact the CEO for the DHSC will be brought back to the Isle of Man to lead the department? If the Chief Operating Officer is leading the department here, then we need to review the CEO post in time then. Importantly, health safety for our residential and nursing homes. Will he agree now that there should be a policy and procedure in place for our residential and nursing homes, both government and private, relatives visiting these establishments where there are clear hygiene rules in place before they actually enter the building, or for self-isolation quarantine purposes before they go near the establishment, and especially for those relatives in the last 48 hours who've returned to the UK via Europe, who are intending to return to the island today before a cut-off point, who have relatives in our homes, and we need some clear guidance there, because they have been in areas, it's been brought to my attention, where coronavirus is at large. I'll put it like that. Very serious, Minister, meant with the gravity it's put. If you could commit to that, I'd be very grateful.
Minister to reply.
Thank you, Mr President. I'll raise the CEO post first. I think there seems to be a misunderstanding what the CEO post is. It's a strategic post in terms of the CEO across the whole department. Delivery on the ground and the combining up of services is the role of the Chief Operating Officer. The Chief Operating Officer, which used to be formerly Director of Hospitals and Head of Community Division, they are responsible for coordinating the response and ensure it's delivered on the ground. That is the role that is absolutely crucial in joining this together, and that the Chief Operating Officer is based on Ireland. In relation to residential and nursing homes, the Department has already been out in contact with the residential and nursing homes, and we have already been speaking to them both around the hand hygiene situation and also if they would wish to actually curtail visiting hours, etc. At the moment, the feeling is that that isn't necessarily necessary at this point in time, but it is something that, again, may well change. But we have been issuing advice to the nursing homes, and we will continue to do so and keep them up to date on any evolving situation as well.
Honourable Member for Council, Ms August Hanson.
Thank you, Mr President. I'd just like to repeat the question asked by the Honourable Member for Douglas East, Mrs Barber, earlier in the sitting. Will immunocompromised healthcare staff, particularly those working in the ICU, be asked to leave, to go home? And just connected to that, have we tried to identify additional aid across the island, should we need it, to people that have worked formerly as healthcare professionals holding up-to-date qualifications? For those who have experience but no up-to-date qualifications, also a list of those with experience that might take on some assisted form of role for extra health support. Thank you, Mr. President.
Reply, sir.
Thank you, Mr. President. Can I thank the Honourable Member for Council for reminding me about the Honourable Member for Douglas East's point, as I did mean to say that at the very, very start when I started answering questions. In relation to immunotherapy compromised individuals, what we will look at is if we can repurpose them into another role, should an outbreak occur. If we can't, then obviously the decision would be taken to remove them from the workplace, because obviously we, as the Department of Health, we are not wanting to be putting people in a position where we are endangering their health. That is quite clear. In relation to the second half of the question, Mr. President, it can be a nice simple yes, and I mentioned it in my statement.
Honourable Member for Douglas South, Ms Costain.
Yes, thank you, Mr. President. And firstly, I'd like to thank the Minister for all the information that he's given to us and congratulate the Department as a whole on all the work that's gone into this. I do have a couple of queries that I hope he'll be able to answer for me. The first is regarding self-isolation. Now, we've heard a lot about it today and we've read a lot about it in the press releases and watched it on social media, etc. But there's still a lot of confusion in the public about the different types of self-isolation, because they hear self-isolation and then they read something that actually doesn't refer to the type of isolation that they're thinking of. For example, somebody coming to the island who's got no symptoms, or everybody coming to the island with symptoms and not has got to self-isolate. But then you have the over 70s and the groups who are more vulnerable. They're being advised to self-isolate. And people are saying, well, does the 14 days apply to them? And we know what we're talking about, but the public don't know what we're talking about on that, because it's all referred to as self-isolation, where there's various different types of self-isolation. So I would ask the Minister if he would just take that concern on board and make sure that it is very, very clear and very clearly laid out for the public so they understand the different types of self-isolation and the rules that go with each type. Also, he mentioned, and I had a query about this very recently, about walking the dog. Somebody over 70 who is self-isolating is being told they have to stay in their own home, even if it means not walking the dog. I think he said it when he was giving his opening speech. So, as we know, not everybody who's over 70 is infirm, or they have dogs that, even if they don't, they want to go out, they want to get some fresh air, and that is actually healthy for them. And a lot of them are healthy. So what advice, and will they be issuing advice to the people who fall into the vulnerable group or the over 70s group, what advice will he be giving them to stay healthy if they have to stay indoors for a considerable time? And my final question, again, reiterating from some of the other people's concerns about the Chief Operating Officer, what qualifications or experience has the Chief Operating Officer had at the strategic level, which he says is what she's doing? But what does she have, and what qualifications does she have that enables her to fulfil that strategic level role without the full-time support of the Chief Executive Officer? Thank you.
I'm conscious of the intense interest of members in this whole issue. If we could keep supplementary questions, with quite a lot of business still got the Treasury Minister to hear from. If we keep them short, please, from this point. Minister to reply.
Thank you. In that moment, Mr. President, I'll try and keep my answers short as well, or shorter than I normally do. In relation, taking the last point first, the Chief Operating Officer still has the full support of the Chief Executive Officer of the Department. That is no different. The Chief Executive Officer is working as normal. In relation to the qualifications of the Chief Operating Officer, rather handily, the Honourable Member for Douglas South put a written question in, I think it was to last month's Tynwald, and she will find the list of all the various qualifications there. In relation to self-isolation, Mr. President, this needs to be absolutely clear. When someone self-isolates, that means they stay at home. In terms of the over 70s, what is being advised is that those who feel they might be in a compromised position or nervous about their current situation, that if they wish to self-isolate, they can do it. It's not a firm thing for us saying they must self-isolate. What we are advising for the over 70 is something called social distancing, which is where if they decide they don't want to stay at home, they want to go out, what they should be doing is ensuring that they consider, do they really want to go to mass gatherings, to crowded places, and do they want to have close contact with people who might pass the virus to them. That is what's being recommended for the over 70s, and there will be guidance being issued in that. The self-isolation applies to those coming into the island, and that is a strict process self-isolation. It means you stay at home for those 14 days.
Honourable Member for Garth, Mrs Kane.
Thank you, Mr President, and I'll be brief, but I do wish to say I also congratulate the Council of Ministers for the policies they've brought forward and for the action they're taking and for the benefit of the whole community. My question for the Health Minister is, in light of the fear, I think it's welcome to have the distinction between social distancing and self-isolation, but he said it's an inevitability that there will be a case of coronavirus on the Isle of Man, and the fear factor is the rate of infection and the number of known contacts. Can he give any figures for the capacity at the hospital in terms of ICU, in terms of ventilators? He mentioned the private wing as well. Given apparently some of the small percentage of people who are at risk of this infection can take several weeks to recover from it. Can he give us any numbers of how well geared up we are to meet that need?
Minister to reply.
Thank you, Mr President. We are in the process of actually expanding it. One of the things that needs to be made clear about this particular virus, COVID-19, Mr President, is there's an assumption that everyone goes into hospital will require a ventilator or ICU treatment. That's not the case. There are people who simply need general medical treatment and isolation in hospital. So we are gearing up both. That is the reason why I've made the announcement in relation to the private patient unit. One of the key things we're looking to do, and this is why we have varied from our advice from that of Public Health England, is where small jurisdictions have had the infection, they have been most responsive and able to actually get ahead of this, because in a small jurisdiction it's easier to do the trace back. That once someone has contracted it and you say to them, who have you been in touch with over the last few days, it's a lot easier to trace back and isolate those individuals than, say, someone in London who turns around and says, well, I was on the tube this morning, I went into Costa, it was really quiet, there was only 70 people in there. It's a lot easier to do. And that is where small jurisdictions have been able to handle this better than large jurisdictions, and that is why we have varied our approach and we are actually looking to continue our community testing.
Honourable Member for Aaron Michael, Mr Baker.
Thank you, Mr President. I'd like to thank the Minister for clarifying the difference between self-isolation and social distancing, which I think is really, really important. Two quick ones from me. Communications is far more than just social media. Would you agree that we need a comprehensive, clear and accessible to all communication strategy around this, and that whilst not everybody reads newspapers or watches videos, equally not everybody accesses social media? And secondly, can you just expand upon the definition of critical staff? The Chief Minister very helpfully talked about medical and flight crew, for example, but there may be other roles where it's actually in the strategic national interest for individuals to be able to come in and out of the island quite quickly. And I'm thinking, for example, of if there was a need, for example, for some critical maintenance at the power station, or some crucial work on the hospital equipment. Clearly, in the national interest, there needs to be those skills brought to the island, and there needs to be a process around that. So could you appreciate you've got to keep it quite tight, but there needs to be some flexibility as well. Could you clarify, please?
Reply, sir.
Thank you, Mr President. Again, taking the last point first, as the Honourable Member for Michael stated quite clearly, the situation will be fluid. So the regulations that will flow off the proclamation made by the Governor will be drafted in such a way that as the situation changes, it can easily be amended what the definition of a key worker is, because there may well be things at the moment that wouldn't necessarily classify as a key worker that may change if the situation develops. For the time being, we are looking mainly around the flight crews, the boat crews, and obviously key medical workers, as the Chief Minister laid out, in relation to oncologists and so on visiting the island. But as I say, that's the situation could change, and there will be the ability in those regulations to allow for the key workers to be added to, should it be required. In relation to communications strategy, I fully agree, Mr. President. I love communications. The amount of times I've mentioned it in this honourable court. It is important that we have a proper communication strategy across all sorts of mediums, and that is exactly why this is a whole government response, and the Comms Division will be coordinating that response across all the government departments. Joined up government, Mr. President.
Mr. Speaker.
Thank you, Mr. President. Can I ask what the current advice is regarding people visiting friends and relatives in hospital, and what the advice is regarding community health facilities? I think the Minister did mention it in passing, but in terms of district nurse contact, about people going to the dentist and these sorts of contacts in the community, can you give us the latest advice on that? And the second part of the question, because I think I'm going to get at one shot at this, how many cases is the Isle of Man going to take before actually things re-escalate our controls, just so that people can know what to expect? If we're talking about this as an inevitability of a case coming, what would that escalation look like, and at what point would that be triggered? So I just leave that question with the Minister for perhaps not answering now, but preparing people for the future.
Minister to reply.
Thank you very much, Mr. President. Firstly, in terms of hospital, we are looking at our visiting hours around the hospitals, and we will be restricting back the visiting hours. In relation to the visiting services, at the moment the visiting services will continue as is. The only issue will be, obviously, if you've got someone self-isolating, then that will have an impact, and we will have to look how we manage that depending upon the individual case that comes forward. In relation to when we will escalate our controls, that will depend on how many cases. It's not a fixed number, Mr. President, because it will depend on what we're seeing. If we're seeing 1 or 2 individuals and we're not seeing human-to-human transmission, then that's a very different situation to say even if we've got 10 or 12 cases of human-to-human transmission. So that will be a clinical judgment, Mr. President. It will not be a political judgment from me. That will be taken by our clinicians on the ground.
Honourable Member for Onken, Ms Edge.
Thank you, Mr. President. Thank the Health Minister for his helpful advice this morning. I've got a number of questions which have either been raised or they've come to light this morning from what the Minister said. Is there an agreement in place with the UK hospitals for critical care outside of coronavirus? Virtual clinics, the Minister mentioned, which is great. We have a number, the Honourable Member for Council, Mr Henderson, mentioned nursing homes and residential homes. We have a number of sheltered accommodations where people do not have access to broadband, and I wonder whether there's been any consideration with the broadband providers to get access to some of these areas. Also, could you just clarify on the private patients unit, is it going to be, the work continue so it can be used as an isolation unit? I wasn't quite clear on that. Can he advise, will the Public Health Director be back on island? Will she be going into isolation if she has been off island? Is it correct that she's not available at the present time? And also, who is the Deputy CEO? And if it's the Chief Operating Officer, who's the next person in line? Thank you, Mr. President.
Minister to reply.
Thank you, Mr. President. Again, taking the last point first. In terms of Deputy CEO, there's several Deputy CEOs split across their different responsibilities. In terms of this, it would rest with the Chief Operating Officer, because this involves the hospital and involves the community services. And below the Chief Operating Officer, it would be the Deputy Chief Operating Officer, Mr. President. In relation to critical care, yes, at the moment our situation in relation to critical care remains we will still continue, if necessary, to transfer people into the UK. Obviously, their health service, depending on which way this goes, may come under strain, so we may have to look at what we're doing on Ireland and change accordingly as to how we can accommodate those people on Ireland if necessary. In terms of virtual clinics, yes, we are looking to do more on that, as I stated in my statement. And in relation to nursing homes, we will be looking wherever possible to work with businesses on the island. We have some very innovative technological ecological businesses over here. We're very lucky and had to have that as part of our economy, and we'll be looking to work with them.
One supplementary.
Thank you, Mr. President. I feel it's an important one. A number of our elderly people are not able to get to testing centres. Can the Minister confirm what will happen in those scenarios?
Minister.
Thank you, Mr. President. As I confirmed in the answer to the Honourable Member for Ramsey, Mr. Hooper, for anyone who is vulnerable, we will actually go out and test them in their home.
Honourable Member Mr Morehouse.
Thank you, Mr. President. Would it be possible to look at the possibility of finding suitable accommodation for people who currently have no suitable place to self-isolate, and possibly the vulnerable who fear being left alone due to underlying conditions and other issues?
Minister.
Thank you, Mr. President. I'm not quite sure what the Honourable Member would refer to as suitable accommodation. We're working with the voluntary sector to actually to identify vulnerable people and actually put support packages in place so that in the event this happens, there is groups and voluntary organisations that will go out and check on them to make sure they're all right. In relation to people not having appropriate places to self-isolate, as the advice is across most jurisdictions, Mr. President, people can simply self-isolate at home.
I'll allow one supplementary,
Mr. President. Could the hotels be considered a suitable accommodation given the pressure they're going to be under?
Minister.
Mr. President, at the moment there is no reason people cannot self-isolate at home. That is the medical advice.
Honourable Member for Ramsey, Mr Hooper.
Thank you very much, Mr. President. I think the Minister has maybe touched on this. He's talked a lot about healthcare, a lot about critical care. I'm not hearing a lot about social care, the other aspect of his department. I'd like to get some reassurance that there is some work ongoing to make sure that people who are self-isolating, who require the support of the social care system, will be able to access it. He mentioned engagement with voluntary agencies. That sounds like a very sensible step. I'd just like a bit more information on this, and also if he will be issuing some guidance for those who are caring for family members.
Minister to reply.
Thank you, Mr. President. Most certainly there will be guidance in relation to family members and those caring for those who might need to self-isolate. In relation to social care, it is the other half of my brief, and it's one I'm very proud to have. I go to pains to point out that I'm Minister for Health and Social Care when people try and call me Minister for Health. In relation to social care, we're not just working with the voluntary sector, and I apologise that the statement came so late, members couldn't have a copy circulated to them, but I did state in the statement that we were also looking at repurposing non-emergency staff, and they will form part of that response as well.
Now I have two final questions to be posed, and then we move on. Honourable Member Mrs Lord Brennan.
Thank you, Mr. President. Just to build very briefly on the points made about social isolation and not leaving the home at all, when it comes to it in guidance or regulations or whatever direction we'll be giving, will the Minister consider that in the round? Because actually I think that there is other advice, perhaps from the UK, that is indicating that if you are going out either to take exercise or get fresh air, as long as you're keeping away from other people, that would be okay. I'd welcome any further thought on that, because I think there has to be an element of personal responsibility around all of this, and it might be more harmful just to tell people they cannot get outside at all. Thank you.
Minister.
Thank you, Mr. President. In relation to the UK guidance, my understanding is they're referring to individuals' gardens that are attached to their homes, so they can go out and use the garden, assuring they're not compromising anyone else. But unless it's radically changed today, the UK guidance is exactly the same as ours in terms of self-isolation, as is most jurisdictions around the world. In self-isolation is literally that, you stay at home. And as I said in my speech, there is a lot of tough things to be done here, Mr. President. It is changing the way that people live for the time being, and people are going to have to make tough decisions, but we have to be exceptionally firm on this. If people are self-isolating, they are self-isolating, and that means you stay at home. If you have a private garden to use, that is fine, but going out, taking walks, that is breaching self-isolation.
And finally, Honourable Member for Garth, Mrs Kane.
Thank you, Mr. President. Firstly, if I could bring the Minister back supplementary to my previous point, what is the capacity, please, of ICU, the number of ventilators? Is this department here, as in England, seeking to purchase any more ventilators? And then on the isolation ward, so the public have an idea of what the capacity would be for both critical cases and perhaps isolation cases. And my other point was, in terms of identifying people with coronavirus at an early stage. There was an incident at the weekend when an emergency service worker from my constituency presented symptoms and was told there is no test for emergency workers, has voluntarily self-isolated and now may be getting a test, but the word from the surgery is still there's no test. So how quickly will testing be available in the community at the appropriate time for people who really need it? Thank you.
Minister to reply.
Thank you, Mr. President. The reason in relation to the test, again taking the last point first, was the advice changed in the UK last week to actually state that only those admitted to hospital should be tested, and that obviously impacted on the microbiological labs that are processing the tests. Since then, we've been working on a workaround so that we can continue community testing. That has kicked in, which allowed us to make the announcement yesterday, and so the community testing is now happening from today. In terms of the capacity, I do apologise to the Honourable Member, I did miss that off. Currently within ICU, I believe in total we can use up to 8 beds, but as I stated in my statement, we are repurposing various areas of the hospital to be able to expand that critical care capacity. In terms of ventilators, in general use, I believe there's 6 off the top of my head, but then we have also we've got the ventilators that we were purchased during the swine flu epidemic as well, that would be brought back into play. Also, one of the Honourable Member referred to what's happening in the UK with the repurposing of various companies to produce new ventilators. One of the great advantages we have as an Ireland, Mr. President, is we are part of the NHS supply chain, and that means there has already been conversations going on about how we would purpose that. But the key point, and I'll be doing a presentation to lunchtime to members, Mr. President, is how we actually deal with the peaks and actually slow the curve. That is absolutely essential for the continuation of our health service.